I'm talking about very important topic, that is abnormal uterine bleeding. It is one of the most common complaint for which the patient presents to a gynecologist. And in simple words, they say कि डॉक्टर cycle irregular है. तो basically we have to differentiate कि जो irregular cycles हैं या abnormal uterine bleeding है, that is outside the normal parameters. तो उसमें क्या चीज़ है? Either it's a abnormality in volume, the patient is bleeding more heavily, or it's the less amount of bleeding, or either it's the duration. Duration means कि cycle की जो 28 days का normal cycle होता है plus minus 7 days, उसमें problem है या फिर उसके interval में problem है. Either she is suffering from more frequent menses or less frequent menses leading, that is simply called the oligomenorrhea. But the important thing is to identify कि जो irregular cycles हैं, then they can lead to anemia, कि खून की कमी हो जाती है, especially in females who are more frequently bleeding or heavily bleeding. That no doubt that affects the quality of life and leading towards the medicines, and the burden of the medicine and the burden of the disease is increased. The important thing is the proper evaluation that include the detailed history, examination, and the lab investigation. Some tests, they are the baseline tests, and some are very specific tests. They are called the diagnostic tests. And one of the very important tests, that is the pelvic ultrasound, and no doubt the complete blood count. And after the basic evaluation, we can further lead to specific tests, like there may be some hormonal problem, thyroid function test, thyroid stimulating hormone, TSH, free T4, free T3, or similarly on history and examination we can decide the further test. But the important thing is to identify the causes. It's a very simple one, life cycle approach for the abnormal uterine bleeding. They can just show कि किस एज में कौन सी कॉजेज हैं जो abnormal bleeding को लीड करती हैं. Like pre-menarche, that means के before the age of menarche, there may be the estrogen withdrawal at birth that can lead to abnormal bleeding. There may be the foreign body, very rare, very rare. There may be a sarcoma, that is a tumor. There may be the ovarian tumor, or the bleeding may be due to trauma. And at the menarche, it takes some time to have a regular cycle, but because of certain problems, there may be abnormal bleeding that may be relating to coagulation defects, or they may be relating to hypothalamic immaturity, or it may be psychogenic. But in the most common, this presentation is during the reproductive years. And in reproductive years, if the patient is married, we have to keep in mind the abnormal bleeding may be due to some complication relating to pregnancy. It may be the early pregnancy, और उसकी वजह से पेशेंट को हो सकता है अभी अपना प्रेगनेंसी टेस्ट का पता ना हो. शी मे बी विद द irregular cycles, and it may be just some symptoms of abortion. और this abnormal bleeding may be due to an ovulation. That means कि egg जो है वो उसकी proper ovulation नहीं हो रही, जिसकी वजह से there may be the hormonal problem leading to abnormal bleeding. Or it may be just because of certain medicines, or there may be some anatomical problem, like there may be some like fibroid uterus hai, like polyp hai, that can lead to abnormal uterine bleeding. Or in postmenopausal, we have to be very careful during evaluation, because with the advancing age, there are more chances कि खुदा ना खास्ता कैंसर होने के chances होते हैं. तो we have to make sure कि during evaluation we are confident कि हमारी evaluation complete है. If there is any chances like endometrial hyperplasia that can further lead to endometrial carcinoma, उसको हमने timely evaluate कर लिया है. Or but in certain cases they may be just vaginal atrophy, or they may be estrogen, because of the estrogen replacement, because few patients they are on hormonal replacement therapy, that can lead to abnormal vaginal bleeding. And important thing is that we have to also evaluate in this age group any anatomical cause, that may be the fibroid uterus, or it may be the polyp. And the management depends upon either it's a surgical or medical management, but the important thing is that there should be accurate diagnosis, and the treatment should be planned accordingly. And after the treatment, the follow-up is very much important, and the prognosis, we have to follow it, because during the evaluation treatment, the main idea is to keep in mind कि किस एज ग्रुप में कौन सी वजह कॉमन हो सकती हैं, और केयरफुल हार्मोन ट्रीटमेंट इज वेरी मच इंपॉर्टेंट बिकॉज हमारे एक्सपीरियंस में हमने देखा है कि कुछ पेशेंट्स वंस इफ दे टेक द हार्मोन बाय द डॉक्टर और नेक्स्ट टाइम मे बी आफ्टर मेनी ईयर्स और वो उसी दवाई को खुद से खाना शुरू कर देते हैं, तो दैट्स नॉट सेफ फॉर द पेशेंट. एन इम्पॉर्टेंट थिंग ड्यूरिंग द एवेल्यूशन इज टू एक्सक्लूड द malignancy, कि खुदा ना खास्ता कोई ऐसी वजह ना हो कि जो कि फर्दर जाके malignancy को लीड करे, because the assumption can lead to severity, and it's much better and safe for you to have a safe treatment, proper evaluation, and treatment with your doctor. Thank you.